Hi, my name is Dr. Nicole. I am a pelvic floor physical therapist here at Pelvic Prescription, and today I want to talk to you a little bit about bladder urgency. Oftentimes in life, we may find that our bladder frequency has increased and we're going to the bathroom all the time, but when we get there, there's really not a lot there, and the urge felt way more intense than what actually happened in the bathroom, and we're going all the time and we still need to go all the time. And we're just kind of stuck in this loop. And so this can happen for a couple of reasons. Our bladder is really good at being trained to do what it's supposed to do, which is tell us when we need to go to the bathroom so that we empty. And so we get different levels of intensity of those bladder urges. Let's say when our bladder is partially full, halfway full, all the way full. And so we want those signals to amplify the more full our bladder gets. Over time, what can happen is that those signals can get amplified when our bladder is not so full. And so what happens when we're dealing with this frequency and there's not a lot coming out is that essentially our bladder has been trained to give us a more intense signal than it should be giving us. And so bladder frequency and urgency and not being able to hold it as you get to the bathroom because that signal is so intense actually has not so much to do with your pelvic floor and a lot more to do with your brain and your bladder's connection. And so typically what we're gonna have to do is some behavior changes. We're gonna do some bladder retraining versus necessarily strengthen the pelvic floor to try and get us to be able to hold our bladder for longer. And so the first thing that I usually tell people to do is stop making it such a big deal. Stop letting your bladder be so bossy. When that signal comes, go, okay, I hear you. I just went an hour ago. Normal bladder frequency is every 2 to 4 hours, and unless we've chugged a gallon of water, our bladder's probably okay. And so I want to start just telling our body, hey, you're not the boss of me. Stop making this such a big deal. And then I'll usually have my patients just start adding a little bit of time in between when they want to go and when they actually go. So if you're washing the dishes, finish the dishes. If you are folding laundry, finish folding laundry. Maybe go before you put it away, but just start adding a little bit of time in between when your brain says I want to go and when we actually go, just to start training our bladder to decrease the intensity of that signal. That's usually where I have my patients start. And then if you're still needing help beyond that, we are here. And there's lots more that we can do to help retrain the bladder and not let it control as much of your life as it is.